The Royal Adelaide Hospital involves 6 years of complex construction and is a 30-year private-public partnership backed by financiers from around the world. And now it's SA's nerve centre for the management of the COVID-19 challenge. Much has been written and said about the biggest infrastructure project in South Australian history. But how did it perform during one of the state's biggest health crises? For Central Adelaide Local Health Network CEO Leslie Dwyer, when the chips were down, it was all systems go at the new RAH, thanks to her team's effort and the work of the hospital's management consortium led by Celsius.
How lucky are we to have 100% single rooms, to have inbuilt features into the organisation that made it easy to control airflow, to make it easy to make sure that we were able to monitor people coming in and out of our building, but to also make it really easy to connect ourselves because of the technology that had been built into it.
South Australia's response has been remarkable, with one of the first testing centres in the world established here. The design and facilities at the Royal Adelaide Hospital made it the logical choice to receive and treat all COVID-19 patients requiring hospital care in South Australia.
At the height of the pandemic, we were actually seeing up to 200 people a day through this clinic, and we continue to use it because we do want to encourage people to continue to come and be tested.
The entire hospital has stepped up when needed.
The Royal Adelaide ICU has seen more patients than most other ICUs in Australia. It's been our central plank of our COVID-19 response in South Australia. This is a new century hospital for a once-in-a-century pandemic. The whole team, the whole hospital has worked together to respond to what has been a very challenging environment.
Many of the hospital's unique features have been specifically designed for the delivery of elite health care during a pandemic. Right, so you can monitor every room?
Every room can be monitored. If there's an issue, it will alarm and the engineering team can respond.
The air conditioning system is set up in such a way that you can isolate areas and then have air conditioning that only works in a special way in dedicated areas. So it's called pandemic mode. That enables us to further isolate patients and protect other patients around them.
During a pandemic, it's essential that health workers minimise the amount of human contact in a hospital of this size. These automated guided vehicles, or AGVs, are ferrying supplies, food, linen, to wherever it needs to go.
Every room in this hospital is a single room. It reduces the risk of infection and cross-contamination by people being able to be in their own room and in their own environment.
South Australia's response to COVID-19 has set national and global benchmarks and has provided blueprints for others to follow.
I think it's been a great investment by the state to have a hospital of this quality here. When you look at the economic value of a shutdown in this state, which is estimated at $500 million a week, it comes into clarity as to how important this sort of facility is. I shudder to think how we would have performed with previous infrastructure.
I think the South Australian community should be so proud of this building. It's a real community asset. So I describe it as a moment where this building has really come into its own. We've learnt to love it.